Hello everyone and welcome to Iconic Voices, a special episode exploring how science and lived experience can come together to transform advocacy in liver health. Today I am joined by four distinguished guests. Beatrice Credi from European Liver Patient Association, Professor Serena Barello, Associate Professor at the University of Pavia and Scientific Coordinator of the ICONIC project, Dr. Michela Monaci, researcher on the qualitative component of the project, and last but not least, Professor Sara Bigi, Professor of Linguistics and expert in medical communication from Università Cattolica del Sacro Cuore in Milano. Did I pronounce it correctly?
Perfectly.
That's good. Together today we will explore how the ICONIC project, strengthening the Science Citizens Alliance to advance meaningful advocacy in liver health, is building a new model of patient advocacy based on evidence, participation, and human experience. Are we ready, ladies?
Yeah. Right.
Okay. So, Beatrice, my first question is for you. How did this collaboration between ELPA and the universities of Pavia and Milano begin? Tell us more.
It began with a simple realization, from the field. So advocacy is becoming more important, but also more uneven. Some advocates are extremely skilled. Some some feel alone and even left behind. At the same time, institutions are asking for patient input, patient expertise, but without a clear method. ELPA saw, in this context, ELPA saw the need to bring structure, evidence, and consistency to advocacy, especially in liver health. So in the liver health field, there are still inequities. And late diagnosis. So we made a bold choice, not just to practice advocacy, but to study advocacy. When we decided to study advocacy, was the moment where we decided to engage with academia and researchers. Because, like Serena, Sara, and Michela, they can help us make advocacy stronger, more credible, and more sustainable.
So maybe a question, why was it so important to explore advocacy scientifically?
Because science creates recognition. As I said before, liver patients face many barriers. Social, emotional, and barriers in receiving late diagnosis. They need advocates who are supported and trained. And policymakers need guidance and needs to understand how to listen in a responsible way and in a meaningful way. A scientific foundation, that's what we are trying to achieve, working together with academia, allows advocacy to be taken seriously and at all levels.
I think this was a very clear explanation. So let's move forward. Serena, my next question is for you. What are the main objectives of ICONIC?
Sure. ICONIC was created to answer to a critical and fundamental question: what makes advocacy really meaningful? Not in theory, because this is something that literature just explored, but we would like to jump into the realities and to describe what advocacy is in the real world, in particular of liver diseases. We wanted to identify in particular competencies that advocates need to understand, firstly, the emotional labor that is behind their work. We would like to co-design tools that can support them, in particular with training. But most importantly, ICONIC doesn't study patients from the outside. It's a citizen science alliance where lived experience and research walk side by side.
So maybe just a comment. So the ICONIC is not just observing advocacy, but it actually it's helping building it. Is that
Exactly,
correct?
exactly. You're right, totally right. We wanted to build up together a model that is scientific, rigorous, ethical, of course, and deeply human.
So maybe let's dive a little bit deeper into ICONIC. Michaela, my next question is to you. So the project is built on 3 scientific pillars. Can you walk us through them?
Yeah, of course. So the first pillar was a systematic review of more than 1,700 documents, and this allowed us to see how advocacy is defined and practiced internationally, and also to understand the values and competencies behind it. The second pillar and the second step of the project was a qualitative research with advocates from 21 countries. And through interviews, we heard their stories, the emotional weight they carry, the resilience required, the strategies they use, and also the barriers they face. And these stories, these interviews showed that inside of advocacy, the part that is rarely recognized. And the last pillar, the third pillar, was co-creation workshops with the ELPA-ICONIC advisory board. And they acted as co-researchers, helping us to interpret the evidence and translate into concrete recommendations and training tools and resources.
I just wanted to repeat, you said 17,000 documents and
sorry.
also qualitative research with advocates from 21 countries. That sounds like a really a lot of work. So firstly, congratulations on this. But maybe tell me, what did this approach reveal?
Yeah, it showed us that advocacy is not just action, it's a human, ethical, and relational practice. And advocates move across different levels, for example, from supporting patients to engaging with institutions and European bodies and policymakers, and turning lived experience into meaningful knowledge and influence. And we also saw the mix of skills this work requires, for example, communication, emotional intelligence, and strategic thinking, and also the emotional weight it carries and often is invisible. And through this project, through ICONIC, advocacy becomes recognizable as a true discipline and something that can be understood, supported, and taught.
Sara, one of the most innovative points of ICONIC is the idea that listening is science. So what does that mean?
That means that listening can be taken seriously. It's not just something that has to do with empathy, but it can be understood as a method. That means that when you can listen systematically, how you do it, you can analyze what you hear, you can code it, you can compare it across cultures, and you can extract patterns. So at that point, listening becomes a way to access those aspects that clinical data cannot tell us, which means meanings, fears, expectations, the micro events of daily life with an illness. So through structured listening, experiences can become narrations, and narrations can actually become knowledge.
It's quite a new approach to this listening, right? So listening is not soft, but it's rigorous.
It is, exactly. And in this sense, it's really a way to give legitimacy to human experience, to recognize that what people live is really and can really be understood as a form of evidence.
Serena, this leads directly to something that you presented in the European Parliament. So listening-informed policies, what are they?
Yeah. Listening informed policies are, in our perspective, policies built from the ground up, starting from what people actually live. Too often, we realize that too often health policies start from assumptions, from percentages, but we know percentages are different from the real world. That's a big problem that in many occasions impact on policies that are not really attuned with the patient expectations or lived realities. When you treat, on the contrary, listening as a scientific method, as Sarah said, experiences are able to become evidence. And when experience become evidence, it can inform better policies and decisions. That is what I emphasized at the European Parliament, a health system that listens early, listens well. This is the starting point. A system that listens late often listens badly. And listens informed policies bring coherence between the world where decisions are made and the world where people live. ICONIC, our project, shows that this connection is possible, not only possible, but also measurable and also replicable.
And it's also true that your presentation was very well received in the European Parliament, so cross fingers for future collaboration, future dialogues there, because ICONIC project is really something innovative and should be out there and should be also on the agendas of policymakers and people that could really help in this sense. You mentioned that it's important to listen early and well. So listening now is becoming this bridge between the individuals and institutions. Is that correct?
Yes, it's correct. And meaningful advocacy stands exactly on that bridge.
Michela, what did the qualitative research reveal about how advocacy is practiced?
We learned that advocacy is lived, is experienced before it is performed. And advocates act as connectors between worlds, from patients, clinicians, civil society, and policymakers. And they translate complexity into meaning. And they hold emotion while providing clarity, and they carry stories that have a weight and stories that can move institutions. So advocacy is not reactive, it's generative.
Can I just stop you here? Because you said advocacy is not reactive, it's generative. What does that mean actually?
It means that advocacy is not only reactive, it's not only a reaction, it can also be proactive and transformative especially when it uses individual stories to turn personal struggle into shared insight.
Sarah, what competences emerged as essential in this ICONIC project timeline? I feel you had really a good time, in this project. So tell us more.
Yeah, so many competences. We found that many are the relevant competences of advocates. For example, the ability to communicate across audiences, the capacity to navigate health systems, emotional regulation, strategic thinking, reflective practice. You understand that advocacy can also be very demanding, both emotionally and cognitively. But it is also a continuous learning journey. So ICONIC really helps us make these competences visible and above all teachable.
So it feels to me that you are closing like this first early chapter and now you would like to move forward. So Serena, ICONIC is now shaping a toolkit and the training. And I would really like to hear more. What are the next steps? What are your hopes? What are you planning to go for?
Yeah, we are developing, we will develop the so-called ELPA evidence-based advocacy school for liver health. As Sarah mentioned, we would like to include topics like ethics, communications, policy navigation, project management, but also emotional resilience, so some psychosocial competencies and mentorship, peer mentorship. The idea is to offer a new pathway that can strengthen advocates without overwhelming them, a place where where experience, all the experiences that they share, may be valued, may be supported, may be transformed into competence that they can apply into their real-world settings.
Sounds like really excited road ahead, and I'm really looking forward to these deliverables, toolkit, training. It will be really nice, I'm sure of it. But maybe Beatrice, a question to you. So how will ELPA use this? Will ELPA use network, connections to different stakeholders? How you plan to use it?
So what makes ELPA stronger is the fact that it's a member-based association. And representative from ELPA members are the people Michela listened to during the qualitative research. So just to close, the circle there, and that I think, but are also the same participating into the advisory board to the ICONIC project. So our members are experiencing advocacy on a daily basis in their specific national context. So what we would like to do is to bring the toolkit and the advocacy school for liver health mentioned by Serena to our national associations. So for the first time, we will have a shared curriculum and shared standards and shared competencies also. And this is how we would like to elevate advocacy across Europe. The concept is really simple. I mean, it seems complicated, but the idea is very simple, and is recognizing advocacy as expertise.
So the title of this project, ICONIC project, is really perfect, I would say, because as you said, you are pioneering in this, creation of shared curriculum, shared standards, with the aim of elevating advocacy to a higher level, which is really remarkable and I believe needed, much needed. So. Ladies, we are slowly moving towards the last session of our talk, and I would like to ask each of you, what does meaningful advocacy mean to you today? What are your messages to the audience, to the listeners that are joining us today? Maybe Beatrice, let's start with you.
Okay, so for me, for ELPA, meaningful patient advocacy is when patients are not the last to be heard, but the first to be listened to.
Serena, we are continuing with you.
So let's say that for me, and from a scientific point of view, meaningful advocacy means recognizing, as mentioned, lived experience as real evidence that we can use for shaping policies, and using this evidence to build listening-informed policies.
Thank you. Sara?
I would say that meaningful advocacy is the power to transform stories into shared understanding and into that transformative energy that Michela was mentioning before.
Michela, over to you.
I think, in my opinion, meaningful advocacy is when a personal struggle becomes a collective voice, and that voice becomes a lever for change.
I have to say that for me, meaningful advocacy is listening as a science, so the courage to hear and the responsibility to act, right? This is like a logical consequence of listening. So the ICONIC project shows that advocacy is both science and humanity. The bridge built through evidence, empathy, and action. So I'm slowly closing this discussion for today. Thank you all the listeners that joined us. Until next time, please keep listening, keep questioning, and keep building meaningful change. Thank you very much for joining us today. And thank you, ladies, for your time.
Thank you.
Cut.